Hypersensitivity reactions are overactive immune responses that can harm the body. They are divided into 4 types, each with a unique mechanism and set of diseases. Type 1 hypersensitivity is an immediate allergic reaction. This happens when the immune system overreacts to harmless substances like pollen, peanuts, or insect stings. The body produces a special type of antibody called IgE, which attaches to immune cells called mast cells and basophils. When a person is exposed to the allergen again, these cells release chemicals like histamine, causing symptoms such as itching, swelling, runny nose, wheezing, or even a severe reaction called anaphylaxis. Common examples include allergic asthma, hay fever, and food allergies. Think of type 1 as immediate IG. Type 2 hypersensitivity is also called cytotoxic hypersensitivity because it mistakenly attacks the body's own cells. This occurs when the immune system creates IgG or IgM antibodies that stick to the surface of normal cells, marking them for destruction. The body then activates immune cells and proteins called complement, which destroy the tagged cells. This type of reaction happens in autoimmune diseases like myasthenia gravis and Graves' disease, and also in conditions like hemolytic anemia and blood transfusion reactions. A good way to remember type 2 is 2 things: IgG and IgM attack cells. Type 3 hypersensitivity happens when immune complexes, clumps of antibodies and antigens, build up in the blood and get trapped in tissues like blood vessels, joints, and the kidneys. These immune complexes cause inflammation by activating complement proteins and attracting immune cells called neutrophils. This leads to conditions like systemic lupus erythematosus, SLE, post-streptococcal glomerulonephritis, and serum sickness. Symptoms often include joint pain, rashes, and kidney problems. To recall type 3, think 3 things: immune complexes, inflammation, and tissue damage. Type 4 hypersensitivity is a delayed reaction that does not involve antibodies. Instead, it is driven by special immune cells called T cells. When the body encounters a harmful substance, T helper cells, CD4+, release chemicals that trigger inflammation, while cytotoxic T cells, CD8+, may directly attack the tissue. This reaction takes 24 to 72 hours to develop. Examples include contact dermatitis from poison ivy, the tuberculin skin test, PPD test, and autoimmune diseases like type 1 diabetes. A simple way to remember type 4 is 4 equals fourth and final delayed T cell response. Mnemonic for the 4 types of hypersensitivity: acid A for allergic, type 1 IgE, immediate allergies, C for cytotoxic, type 2 IgM attacking cells, I for immune complex, type 3 immune complexes stuck in tissues, D for delayed, type 4 T cell mediated, takes days to develop.